We will now demonstrate the use of the elastomeric infusion device. The nurse or caregiver will wash their hands and assemble supplies on a clean and dry surface. The supplies include the elastomeric device, 2 saline flushes, alcohol swabs and tape, and a heparin flush if it's an open-end catheter. You will notice on the table here we have 2 elastomeric infusion devices. One is completely filled, and this is what it looks like when it starts, and the other one is empty. This is what it should look like when the infusion is completed. The nurse will now loosen the clamp on the tubing and loosen the cap on the elastomeric infusion device just slightly. This will allow solution to fill the tubing to the end, with 1 to 2 drops appearing under the cap. Once that occurs, close the clamp on the tubing. The nurse will now cleanse the threaded end of the needleless injection cap with 3 alcohol swabs, wiping for 1 full minute. Remove the cover from the saline flush and screw the syringe directly onto the needleless injection cap. Insert contents of the flush using a push-pause technique, then unscrew the syringe and discard. Remove the cap from the end of the elastomeric device and screw the tubing directly onto the needleless injection cap. Release the clamp on the tubing and make sure there are no clamps on the IV access device. The infusion will take approximately 60 minutes, or as directed by the medication that is particularly ordered for you. When the infusion is completed, the elastomeric ball within the device will be depressed, and the device should look similar to this. Once the infusion is completed, the nurse washes and dries her hands again. Clamp the tubing on the elastomeric device and unscrew the tubing from the needleless injection cap. Cleanse the end of the needleless injection cap with 3 new alcohol swabs, wiping for 1 full minute. Remove the cap from the saline flush and screw directly onto the needleless injection cap. Insert the contents of the flush using a push-pause technique and leaving approximately a half a cc in the syringe. Unscrew the flush syringe and discard. If this is an open-end catheter, you will need to follow with a final flush with heparin 3 cc's using the push-pause technique. Dispose of all supplies. This completes the procedure for the elastomeric infusion device.